The partnership started with COVID-19 vaccination, and it became immediately clear that the community lacked low barrier access to some basic health care, particularly vaccinations and general healthcare education advice. So we've been doing twice a week minimal clinics here in the Tenderloin since May of 2021. We've done over 400 pop-up clinics altogether.
As we all started with being out in the street, and we would, at the time, the whole, everyone was in lockdown, streets were closed off in different areas, and Glide had its street off from Taylor to Jones. And in that space, we were able to create this long process for getting people the translation that they needed at the start to be able to complete an application for getting vaccinated.
Because UCSF, Code Tenderloin, and Glide collectively have made a big impact on the community as a whole. And without that presence, I think it would be a hole or a void, so to say, in the community as to who to turn to get that information, and not just have random people giving them information, which would create that misinformation lane once again.
We've been doing COVID-19 vaccines, and then we added in flu vaccines, also monkeypox vaccines. As I said, we started wound care because we saw the need for it in the community. And we do the wound care wherever people are at on the streets.
In their tents, we're meeting people on street corners, we're meeting people in the lobbies of their SROs. We're going into different kinds of programs, re-entry programs, different supportive housing services, and just checking in with folks to see what vaccinations they need and if they need any other connections to healthcare services.
We also give out Narcan and fentanyl testing strips. And most recently, we started here at Glide in the parking lot doing hepatitis B testing and vaccination.
We've been here for 4 years now, and I think that have shown that people really enjoy it and count on it. We've done over 24,000 vaccinations. We've done almost 1,000 wound care encounters. We've distributed thousands of home care COVID tests.
At our site here on Glide in the parking lot, we see team members from Glide that come in and get their vaccine. We see people that are unhoused get their vaccines. We've seen people come back year after year because they trust Glide for what Glide has to offer. And it's not me, it's not that they know me to trust me, it's that they trust Glide, they trust UCSF. And so that's why this partnership is important for the community. And then with the help of Code Tenderloin, we're able to provide more services.
So one of the things that we decided to do, Code Tenderloin, Glide, and UCSF, were to do follow-ups with the community. So even though we was able to follow up with most of the community because it was a multiple series of shots that they were receiving, so the community was also coming back to us to give feedback as far as how the information played an important part in their households and their ability to get their shots, not having the credentials, so to say, to go to a hospital.
I love coming to the Tenderloin, and I actually feel like it's one of the most welcoming communities I've ever had the privilege of working in. People say that it's a rough area, but this is the place where everything's coming together. The inequities of our healthcare system, the inequities of our socioeconomic systems, and honestly, the institutional racism that's plaguing our society, it's all right here. This is reality, and so there's nowhere else I would love to be and honored to be serving than right here in the Tenderloin.
It's interesting to see how much community there is here and how that feels welcoming, especially doing this role. It felt a lot more different than what I was expecting, and that's one reason why I keep coming back. Many of our members, just like myself, have a primary job with UCSF, either at Parnassus in the ICU, in the emergency department, that can come down here and also experience these things. And then the benefit is they bring that experience back to UCSF. They bring that experience back to when they take care of unhoused people at UCSF. And I think it broadens everyone's understanding of each other.